Several kinds of albinism. There's albinism that is oculocutaneous, where the eyes and the skin are all abnormally albinotic, and this is an autosomal recessive condition. There's reduced melanin in each melanosome. Remember that these children have nystagmus, photophobia, possibly strabismus, decreased vision because they don't have a macula, iris translumin defect, reticulogenicular striate problems where the projections desiccate. So you should have in a normal eye where the lateral projections don't decussate. In albinism, they all decussate. Here's a picture of the transillumination defect. There is also an X-linked variant of this. And here you see ocular albinism that is X-linked. They get hypopigmented fundi and a hypoplastic fovea. There's a total reduction of melanosomes. In the autosomal recessive, there are 7 separate genes, but they're identified by whether they're tyrosinase negative or tyrosinase positive. It's important to distinguish 2 kinds. They love to ask this, the Chediak-Higashi. These are a type of albinism that is infection-prone and it can be lethal, and the Hermansky-Pudlak that have a platelet abnormality and are prone to EC bruising and bleeding. Leber's congenital amaurosis. This has become famous recently because of the gene therapy that has been used in dogs to treat this. It's called LCA. It's an autosomal recessive disorder with abnormal photoreceptor cells. It's characterized by nystagmus, sluggish or no pupillary responses, severe visual loss, and here are the genetics. And Jean Bennett and Al McGuire have been treating this in some clinical trials at the University of Pittsburgh. Von Hippel Lindau, this is the man himself. It's called Von Hippel Lindau disease, or VKH. There are 1 or 2 copies of the so-called VHL gene on the short arm of chromosome 3 that are mutated. And there is a von Hippel-Lindau tumor suppressive gene. And the gene functions to suppress the growth and reproduction of cells that would otherwise reproduce continuously and indiscriminately. And the VHL gene produces a protein that plays a role in making these cells not reproduce. This is a typical picture with the complex of arteriovenous tumor. It's an orange-red tumor that's fed by a dilated arteriole, and there's an abnormality in the regulation of the cell growth and the cell replication. They form cysts, and they can have cancerous and non-cancerous tumors. The central nervous system tumors are of extreme interest to us, and we always check these patients for hemangioblastoma of the cerebellum, medulla, and pons, and of the spinal cord. And here you can see hemangioblastoma. We also have to worry about visceral lesions, cysts of the kidney, pancreas, liver, epididymis, and ovary. And more importantly, renal cell carcinoma, meningioma, and pheochromocytoma. Renal cell carcinoma is known to be lethal in these patients. When the lesion is discovered, you should do a systemic workup. Look for the renal cell carcinoma and the pheochromocytoma and the CNS lesions. Those are the things that can kill the patient. Here you see a picture of a retinal hemangioblastoma with subretinal fluid. We treat these with photocoagulation, cryotherapy. These tend to come again after you treat them, and you need to identify all of them and keep a watch on these patients. Some individuals have suggested its success in treating the smaller angiomas with PDT.